the hemifacial spasm, the clue is in the title, really. Hemi means half, facial means face, and spasm is when muscles contract involuntarily, when you don't want them to contract. Hemifacial spasm is a condition which is quite rare, but not exceedingly rare. About 1 in every 1,000 people can suffer from it. And although it's not a life-threatening affliction, it can affect patients in really serious ways. The face is our shop window. When we meet somebody in society, it's the first thing we present to them. And having abnormal involuntary contractions of half of your face can be very embarrassing from a social perspective. People can become very depressed about this. They can become very anxious about this. It leads to people sometimes changing their job or losing their job or losing their confidence, not only in their work life but in their personal life. So although it's not a medically serious condition, it's a socially very debilitating condition. And of course it can affect things like reading and driving, because if your eyes are closing involuntarily, then that can affect your everyday tasks. The main cause of hemifacial spasm is what we call neurovascular conflict. What do we mean by that? We mean that there's a blood vessel that is touching the nerve that moves the face as that nerve comes out of the brainstem. Quite simply put, it's usually just bad luck, in the sense that as we get older, our blood vessels become a little bit more tortuous. They become a little bit more bendy. The example I like to give patients is that if you have a hose pipe on your lawn and you open and close the tap under very high pressure, 70 times a second, you would expect that hose to wriggle around on the lawn. And that's what happens to our blood vessels inside our head. Our heart beats 70 times per second on average, and it's doing that for years and decades. And therefore, the little hose pipes, the little arteries in our head become bendy, more bendy as we get older. And if we're unlucky enough, that little bend in the blood vessel can touch the nerve that moves our face as that nerve comes out of the brainstem, and it can irritate that nerve. And actually we think there's an interaction between tiny little nerves that surround the blood vessel and the nerve that moves the face. And therefore you get crosstalk between those little nerves around the blood vessel and the nerve that moves the face. And just like in the bad old days, when you pick up a phone and you listen to somebody else's conversation because there are crossed wires, we actually have crossed wires inside the head. And for 90% plus of people with hemifacial spasm, this is the likely underlying cause. And what that does is it gives us an avenue to a surgical therapy which involves moving the blood vessel away from the nerve. So the answer to your second question is it genetic? It's extremely rare to have genetic background to hemifacial spasm, and most patients with hemifacial spasm, this doesn't run in family. So hemifacial spasm is a clinical diagnosis, by which we mean the diagnosis is made by taking a detailed history from the patient and doing a detailed examination. There are what we call differential diagnoses, which are conditions that can mimic hemifacial spasm. But in people who are experienced at looking after hemifacial spasm, the diagnosis is usually fairly obvious. There are a few tests that we can do to corroborate or confirm that diagnosis, and one of them is an electrical test. And what that does is we test the electricity that of the nerves supplying the muscles of the face. And what we can do is stimulate one nerve and see that electrical activity jump into a different branch of that nerve. And really there shouldn't be any crosstalk between the branches in that nerve. So when we do see this crosstalk, we call it lateral spread. And this is an electrical test that we can do to investigate further whether hemifacial spasm is present or not. So hemifacial spasm is not really a serious medical condition. And what do I mean by that? It's not a condition that puts you at increased risk of having a stroke or increased risk of losing your life. So from the medical or biological perspective, it's not a serious condition. The flip side of that is that it does affect a very important part of our anatomy, our face, which is It's the first thing that other people see about us, and therefore from a social perspective it can be extremely debilitating, and it's often difficult to put yourself in somebody else's shoes. But the closest I can think of this is sometimes when you're tired, your eyelid flutters a little bit, and it does that continuously for a few minutes, and it's already very annoying. When you have this involuntary movement that's affecting more than just your eyelid, but sometimes the whole of the side of your face, and not just fluttering, but also spasming. And this tends to get worse when we're a little bit stressed, and therefore when we're in social conditions. Of course, it's worse than when we're on our own. And this can cause people to become very socially withdrawn. It can cause a lot of anxiety. It can cause a lot of low mood and depression. And some people deal with this very well, and they adapt to this, and they accept it, and they explain to their friends and to their acquaintances that this is an involuntary condition and that they're not actually winking at them all the time. But other people find it very difficult. So how people deal with this condition can be very varied, but it can be very debilitating from a social point of view. And I've always taken the view that really it's up to the person who's living in those shoes to decide whether this is something that they can tolerate and accept and live with, or whether this is something that they want to try and get rid of. So hemifacial spasm is sometimes treated by medication, but I have always found that to be not very satisfying. The reason being that when you give medication, what you're doing is calming the nerves from firing, and often the side effects of that are worse than the disease, because by the time you've given enough medication to calm the face from firing, it's also calming all the other nerves in the body and all the other neurons in the body, and therefore side effects tend to include drowsiness and a foggy head, and people are very badly affected and really don't tolerate the drugs that are effective very well. So although one can try medication, it's often not very helpful. And the mainstay of treatment of hemifacial spasm is the use of Botox. And Botox is short for botulinum toxin. It's actually a poison produced by tiny little bacteria, and given in sufficient quantities that could kill you. However, when it's used in tiny quantities, all it does is weaken the muscles that you inject. So Botox is often used in the cosmetic industries to paralyze the muscles of the forehead, to stop your forehead from creasing, and to prevent the signs of aging. But it's also used in hemifacial spasm, where we can weaken the muscles that are excessively contracting, and that stops those spasms from being so severe, from being so obvious. And Botox can be a fantastic therapy. In many patients, that's all they need. And what the good thing about Botox is that it wears off. So if you're given a bit too much Botox and you have a droopy eye, that's only temporary, and over time it will get better. But the bad thing about Botox is that it's temporary, and if you get it spot on and you have a really good result, after a few months the effect tends to wear off, and one has to come for repeated injections to make sure that spasms don't come through. But in very experienced hands, including the neurologists that I work with closely at Queen Square, you can get fantastic results with Botox. I always encourage people to at least try Botox before they even consider surgery, because you may not relish the idea of having Botox injections on a regular basis, but actually once you've tried it, the needles that are used are absolutely tiny, so one hardly feels the Botox going in, and the results can be quite phenomenal with very low risk. So as I say, I think Botox is a really good first-line treatment for people with hemifacial spasm. If you've tried Botox and it's not for you, either because you've had some side effects from that, or because it's not doing as much as you'd like it to do in terms of controlling the spasms, it's worth speaking to a surgeon about the other option, which is surgery. And what neurosurgery would involve is an operation to move that blood vessel away from the nerve, and it can be a very effective operation, resulting in a cure in 80 to 85% of people. It's a very individual thing, and one has to speak with an experienced surgeon who's done a lot of these operations before, so that he can give you a good idea of what the risk-benefit ratio is in your particular case. Because if you have a very large blood vessel, that can be technically more tricky, and the risks go up a little bit. If you have a very small blood vessel, the chances of helping the spasms are a lot better, and the risks go down. So it's a very personalized consultation. It's not a small operation to get over. Most people spend 3 or 4 days in hospital, sometimes up to a week, and it can take 4 to 6 weeks before you're back to your full self. But as I say, it's one of the most rewarding operations that I do, because patients often find that the benefit they receive is huge, in terms of the fact that they don't realize how badly the spasms were affecting all the social aspects of their life until they've cured the spasms.